We provide a whole array, a whole spectrum of services for them, from the traditional library services into the more in-depth, complex services, and I will explain what those are a little bit more, to a more collaborative, embedded relationship with our users, and I'll also explain more about what that means. So, discussing a little bit about introductions and information needs assessments. We've tried very hard in the School of Medicine, in the School of Public Health, in the School of Nursing to match informationists with varied backgrounds. Some of us have clinical degrees, some of us have subject expertise. With different Johns Hopkins departments, we did an inventory of these departments in each of the schools and tried to assign informationists who either have interest in those departments or who have subject background expertise in those departments. We spend a lot of time investigating these departments, kind of proactively finding out about what they do, how they do their work, what they're passionate about, what their relationship is with information. I think one of the things that we do very well is we're able to perceive what a user's relationship is like with the unknown. How do they feel when they don't know something? And many people I've heard, including myself, say, specifically with the physicians and researchers, they don't like to admit that they don't know something. Everybody have that experience?
Yeah.
They are very overconfident. They don't necessarily like asking for help, but they also fully admit that they don't know what they don't know, which is where one of our challenges lies. We wind up doing a lot of investigating. We look at websites that they have put up. We search their names in PubMed. If we are going to a meeting, we will find out what their research interests are. We do a lot of what we laughingly call reconnaissance before we go in and meet a user group. We then try to contact key members of these departments and ask for just the start of an initial dialogue about what their needs are and how the library can help best meet their needs. And each department, interestingly enough, is very different. Not every department wants the same things from the library, but we will extend the array of services to each department and see which services they really like and try to tailor-make what is easiest for them and what is best for them. We also request something that we are now calling office hours, where we will say to them, would it be helpful to have one of us nearby you, in closer proximity? And sometimes what they say is that we will be invited to come and spend a couple hours a week, 2 to 4 hours a week, where we are in their space, where they know, the department knows that we are there, so that if there's an information question that comes up, they don't have to physically come over to the library and ask us a question. We are nearby them. It's almost as though we're saying, if you're out of sight, you're out of mind, because no one really comes over to Welch Library anymore because we've made it very easy for them not to do that. And so if they want the human experience, we say, we would be happy to come and spend some time with you. Other venues for regular on-site informationist participation are, many of these departments have information venues. They have journal clubs, they have case conferences, they have seminars, lectures, grand rounds, and we try to find out where they would like an information specialist, where it might help them do their work to have us in more closer proximity, and I'll give you a few more examples of this during the talk. What you're seeing now on the screen are a spectrum of services that we provide for all of our users. We do everything from access troubleshooting. These are the most popular questions, which are, how do I get this PDF? We are involved in collection development. We are moving toward more an evidence-based medicine type of collection process, where we want to know that what we are acquiring, what we are buying, what we are renewing follows what our evidence says our users are actually taking advantage of. We do individual and group consultations on everything from searching to bibliographic management. We do numerous information searching, but not just for literature, but for patents, for funding, for data, for statistics. One of the things that you find out very quickly when you work for Hopkins is the publish or perish phrase is very common at Hopkins. It is a primary research institution, so the pressure to publish is very high. People will come to Hopkins to begin their medical careers. They will come for medical school, they will come for internship, they will come for residency. They will spend a few years doing clinical work, but then the pressure is on for them to acquire grants that will help fund the institution. Hopkins is the largest awardee of the National Institutes of Health grant money, or federal grant money, but they also have to publish. So very often the emphasis at Hopkins is on research, and that's where I think as a body of informationists working for Welch Library, we have really found our niche. We also try to find out whether or not the department will benefit from having a customized digital information portal, and I'll show you one of these toward the end of my talk. I'll talk a little bit about on-site office hours, on-site participation in departmental activities. We do library orientations for incoming faculty, incoming students, incoming staff. We do library-sponsored classes and lectures on a variety of different topics. We offer publication support. This is anywhere from answering questions about copyright, open access. And also we participate in the curriculum courses that are already established in the 3 schools.